instructed by Dr. Patricia Brown. The education topic of interest for this presentation is the script talk device, and learners would be the veterans or patients of the Blind Rehab Center, otherwise known as BRC, and they would fall under the category of baby boomers or Generation X. So Script Talk is a device that's coupled with prescription labels and also a Script Talk device or a phone application, otherwise known as an app. It allows for medication identification, so it will tell the patient about the medication itself, the patient's name. It will also tell the prescriber name, the route, the dosage, any contraindications or warnings, as well as other information regarding the pharmacy. And the Script Talk device can provide support for those who don't have either family members, home health care, friends that can help them identify medications or fill out their prescription planners. It allows for safe medication administration, and it was actually found that by the World Health Organization, about 2.2 billion people as of 2022 had a visual impairment of some sort involving either long distance or near distance vision. And due to this, safe medication administration can be problematic. What Script Talk does is that it allows for safe medication administration because medication labels and expiration dates are all stated out loud. For this presentation, I have selected the psychomotor domain, and the psychomotor ability occurs when an individual is able to obtain psychomotor skills upon repetition and practice. Psychomotor skill acquisition is positively linked with educator-guided remote skill training, such as simulation. The learning objective that I've selected for this presentation is by the end of the learner's first week at BRC, the learner will be able to repeat the educator's steps for how to utilize a Script Talk device. This objective allows the learner to be more cognizant of the steps that are necessary prior to actually administering the medications for themselves. The learning strategy will involve simulation-based learning, otherwise known as SBL. SBL allows for learners to experience a real-life scenario without putting learners at risk for any medication errors. It also connects content that has been previously learned to practice, and it can assist learners in obtaining knowledge, skills, confidence, and learning satisfaction as well. Prior to the SBL occurring, the educator must first prepare the scenario. Preparation of the scenario can involve obtaining information on the learner, and information, for example, can pertain to the person's race, ethnicity, age, as well as gender. The educator can also assess the learner's readiness to learn. For example, if the learner is showing signs of stress or anxiety, they may not be ready to engage in this learning activity. The educator can also provide a learning environment that is more calm and also secluded to enhance learning, to ensure also that they are not interrupted during this learning activity. Other scenario preparations can also involve obtaining the items necessary for the scenario, but the educator can just place these items within the room so that the learner can actually obtain the items themselves. This can also involve obtaining the medication planner that the learner will actually utilize at home. When the learner is ready, the educator can start by introducing the scenario to the learner. The educator can inform the learner that the pills utilized are actually just pills that are used for simulation purposes. They can also obtain the necessary script talk device that the patient uses in the home, or in this case, they can also use their phone. The educator will also obtain the pill planner that the learner uses at home. After that, the educator can then have the learner gather the necessary equipment for the simulation. Medication planner, the prescription bottles, a non-slip pad, and the script talk device or their phone can be obtained, and the educator can utilize a checklist to ensure that all the items have been gathered. And based on the checklist and how the learner does, the educator can give feedback at this point on the items that were acquired or not acquired in this case. After all the materials have been gathered, the educator can then state to the learner that at this time they will not be giving any feedback, but will simply observe them filling the pillbox planner, utilizing the script talk device. The educator can also inform the learner that though they're simply observing, they're still available for any questions if needed. And the educator can also utilize a checklist for the medications that were filled and if certain steps were followed. After the learner has filled out the prescription planner, then they can do a debriefing with the learner. The debriefing with the learner can involve the educator asking the learner open and closed-ended questions such as what went well, what would they do differently, and do you think you understand the steps necessary for utilizing script talk to fill your medication planner? The educator can also provide feedback such as information on completed tasks or incomplete checklists. They can also provide information on observed behaviors of the learner. For example, if the learner didn't do something correctly, or if they, for example, put a medication on the side that they hadn't filled yet, or if they put a medication twice in the same slot. Other feedback that the educator can provide for the learners would be suggestions for future instances. For example, the learner can fill only the morning portion of their pillbox first before they fill out the other portions of their pillbox if needed. Overall, the educator and learner can work together to see if further training is needed. Thank you for listening to my presentation on how simulation-based learning can be applied to a psychomotor domain objective in the utilization of script talk. And the following slides have my references